health information used to kind of be in the back room, it was behind the scene, but you guys have really stepped into a very visible part of healthcare today.
Yeah, and I'm hoping even more visible as we move into the future. Like you said, we've been in the basement, but we used to call it the garden level. So to make it a little more appealing, we've been responsible for making sure that the clinical documentation in the chart is accurate. We've protected privacy, ensuring compliance. And I think that organizations even more now, and I think even more going into the future, they're starting to realize that the AI success, it's not really totally reliant on that algorithm behind the scenes, but it's really determined by the quality of the information that's feeding that algorithm. So, it's a great place for us to be as health information professionals and advocate, for ourselves, and as AHIMA to advocate for our profession that, what we've known all along is that trusted information is the foundation of quality healthcare.
Welcome to Beyond the Blueprint, a podcast designed to empower healthcare professionals to improve care delivery through integrated design and technology innovation. My name is Keith Washington, and joining me is my co-host,
Chris Baird.
Whether you're redesigning a hospital, launching a new digital initiative, or just curious about the future of healthcare, well, you're in the right place. Let's explore together what's possible when we go beyond the blueprint.
Now, before we dive into today's discussion, I want to recognize our valued sponsors who've made Beyond the Blueprint possible, Simplify Medical. With their support, we're able to bring you insightful conversations around healthcare design and innovation. If you enjoyed today's show, I encourage you to subscribe so you never miss a future episode.
So welcome to Beyond the Blueprint. I'm Keith Washington, and today we're excited to be joined by Jennifer Mueller, a Senior Vice President of Health Information, Career Advancement, and Academic Affairs at AHIMA. So Jennifer has a remarkable career that spans health information management, executive leadership, and now helping to shape the future of the profession through workforce development and academic partnerships. She's been in healthcare long enough to see patient records go from paper to electronic. And so we're really excited to have her today on Beyond the Blueprint, talking about how, technology alone isn't going to necessarily transform healthcare, that it takes people and leadership and thoughtful approach to system design. So Jennifer, welcome to Beyond the Blueprint. Just thanks for joining us.
Thank you. Thank you so much for having me. Looking forward to the conversation.
Great. Wonderful. So I guess one of the reasons that we're especially looking forward to today's conversation, that AHIMA has been really helping define what it means for healthcare care organizations and preparing for all the change, particularly with AI coming on and having these important discussions. So rather than me leading the discussion today, I want to turn it over to my co-host, Chris Baird. Chris has done a number of these with us. Chris, we're just so glad to have you and talk to leaders from your point of view in terms of culture and change management and decision-making and patient experience. So if you don't mind, Chris, I'd like to turn it over to you to take it from here.
Absolutely. And thanks again for having me, Keith. It's always a pleasure. So just by way of background, Jennifer and I have known each other a very, very long time. I think
almost 30 years, probably.
Yeah.
I think.
Since you were an infant. You were an infant.
Yes.
Coming in as director of medical records, I believe, when I was VP of marketing.
Yes.
So we go way back.
You became one of my mentors, and I've appreciated that.
Well, and you're one of my prized proteges.
Oh, very good.
So Jennifer, one of the key things I thought we should start with was tell us about the organization so people understand, AHIMA, what it stands for, what it is you guys do. And, let's start from there.
Yeah, no, that's great. Well, AHIMA is the American Health Information Management Association. We've been around almost 100 years. So in 20 will be our 100-year anniversary. We're really looking forward to that. And our mission has really always been to advance trusted health information. Our official mission statement is empowering people to impact health. And it just really is, over the course of our lifetime as health information professionals and AHIMA, we have seen a lot of change over the years. We've gone from, when I started way back 30 years ago, we still had paper medical records. And so we've seen and led those efforts to transition from paper charts to electronic health records. We've converted to ICD-10 from ICD-9, and now, of course, this big transition to artificial intelligence. So our mission has been the same, basically, advancing trusted health information. But at the end of the day, we are a membership association. So we have nearly 60,000 members, and they're all across the domains of health information, from medical coding, privacy, clinical documentation, integrity, just all across all of our domains. And right now, AI is really impacting most, if not all, of those domains. And so at AHIMA, we've really been trying to make sure that we ensure that our members are ready through professional development, through appropriate credentials, micro-credentials, and things like that, because our members are really the professionals that make sure that information can be trusted.
Yeah. I love the mission, advancing trust. I mean, when you think about medical information, healthcare information, I mean, if it's not accurate, if people can't trust what's in their charts, what's in their records, I mean, you can just destroy the relationship with an entire organization, not just the provider, but and that's the business healthcare really is
Yes.
trust. I mean, we think about it as delivering medical treatments, et cetera, but it's foundational that trust is at the very core of everything that is done. So I love that. You and I had an interesting conversation a while back. And I think it's germane to this group listening, but people often kind of think interchangeably between health information and IT. And I'd love for you to help make that distinction.
Right. Yes, it is something that the lines are getting a little more blurred as we do more work with informatics. But what I like to say sometimes is health IT, they build and maintain the technology. And then the health information professionals ensure that the information that's inside that technology can be trusted. So it's kind of like if you're building a house, health IT builds the structure. So they have like the wiring, the plumbing, the foundation, and all of that, where the health information professionals ensure that what's happening inside the house is safe, it's reliable, it's functioning, all of that. So, but we need both of us professionals, health IT professionals, health information professionals. But really, like looking forward, it's important to distinguish between the two, because with AI isn't making decisions so much based on software, it's making decisions based on data. And so like if our documentation is incomplete, or like patient identity, if there's duplicates or overlays, or the coding isn't accurate, all of that stuff, the AI is just learning from all of those imperfections, and it's only as smart as the information that's given. So it is some two roles that sometimes get used interchangeable, but they are very different functions.
Yeah, and health information used to kind of be in the back room, it was behind the scene. And I think about when I was nursing, when I was a registered nurse, the charting and things that we did, it was all on paper and there it was, but I didn't really think about we were always taught to make sure it was accurate, and, if it wasn't documented, it wasn't done.
Yeah.
But you guys have really stepped from behind the scenes into a very visible part of healthcare today.
Yeah, and I'm hoping even more visible as we move into the future with leading AI efforts. But you're right. Health information professionals, we've been the people working quietly behind the scenes. Like you said, we've been in the basement, but we used to call it the garden level. So to make it a little more appealing. But yeah, patients never met us. Physicians would know us, providers would know us. But at the end of the day, we do influence every interaction that happens in the healthcare system. We've been responsible for making sure that the clinical documentation in the chart is accurately supporting the patient's story, and then that the medical coding reflects what is documented for accurate reimbursement. We've protected privacy, ensuring compliance. Now, a big one that's been coming up a lot, which actually, oddly enough, we've been dealing with forever, but patient identity. Because of the increased amount of data that's flowing across our EHRs, across our health information exchanges, it's even more important than ever that we have patient identity accurate and that we don't have multiple patients on one chart or one patient with multiple charts. That's just it's dangerous for one thing, but it really does confuse, the transfer of information. But yeah, so the work hasn't changed much over the years, actually, but AI has definitely put a spotlight on the work that we do. And I think that organizations even more now, and I think even more going into the future, they're starting to realize that the AI success, it's not really totally reliant on that algorithm behind the scenes, but it's really determined by the quality of the information that's feeding that algorithm. So, it's a great place for us to be as health information professionals and advocate, for ourselves, and as AHIMA to advocate for our profession that, what we've known all along is that trusted information is the foundation of quality healthcare.
Yeah, absolutely. So one of the things you had mentioned earlier that I thought was a great point is AI readiness.
Yeah.
And what does that look like for an organization?
So it's changing all the time, so as an organization like AHIMA, we really are trying to make sure that our professionals, our members, are as AI ready as we know it today. I think it is not always about the technology, about buying the software. I mean, that's kind of the easy part. But, what we're learning from organizations out there that have AI adopted in their organizations is that it really starts with the people. And so, leadership and organizations should be looking to, health information professionals to be on governance committees, or they should be asking themselves, do we have a governance committee? Who's accountable for these AI software and for the outputs? Do we trust our data? They should be looking at things like, have we educated the workforce? And if we haven't, how do we do that? How do we monitor AI? How do we know when something is wrong? So all of these things, these are all questions that we're trying to answer because we know organizations are starting to ask themselves these questions, because really at the end of the day, governance is of utmost importance. Right now we should be solving problems with software, not buying software, in the hopes of solving problems. We should know what that is before we start, and then define that accountability, have policies in place. So we're at our organization, AHIMA, we're trying to create templates we have an AI governance sample policy out there, AI vendor selection rubrics, templates for, measuring one AI software against another. We have lots of different tools that health information professionals can use in their organization to really help their teams be ready for AI. But, we're going to continually be looking at the industry and just trying to keep up with it. So it's
As we all are.
It's moving fast. Yeah.
Yeah, I mean, it is. It's moving really fast. There's almost the hype around it. It can kind of dilute the message. So I love that you had said you've got to know what problem you're solving before you jump in,
Yes.
to all the different programs. What are you trying to solve? What will become easier, more efficient, whatever, as a result of.
Because we've heard a lot of organizations sometimes are implementing the AI solution, or they're turning on the AI functionality in their existing systems, and then they're trying to figure out the governance after that. And it really should be that other way around.
Exactly. Exactly. So as you're, dealing with all the other health information professionals out there, what are some of the most common questions, if you will, that come up as they're trying to navigate this immense change?
Right. Well, the main question that we hear all the time is AI going to replace my job? Is AI going to take my job away? And, what we've been saying is no, it's going to absolutely change your job. But we do know that jobs are being replaced by AI. So, but a lot of organizations, what we've been hearing is that they're doing that through attrition. There's especially in the health information profession, we are an old profession, meaning we are, I think average age is like, I can't remember if it was 54 or 56 years old. So, as we're retiring, a lot of those roles aren't being filled. We also don't have as many people coming into this profession as maybe we once had, so we have a whole strategy around trying to build that workforce at AHIMA. But, it definitely is changing the mix of what we do. We have so many transferable skills as health information professionals that, if you're a medical coder today, there's a lot of things that and can be transferred into becoming a medical coder validator, a coding validator, so that you're validating the exceptions or the output of the AI, while the more repetitive, more straightforward tasks run through the AI algorithm. So it's that it is replacing some of the jobs, but it's changing them and actually elevating the opportunities out there for health information professionals. And I just think the people out there that understand how AI fits into healthcare, so like they understand governance, they understand information quality and documentation and privacy, all of our domains, and the ones that are willing to continue learning, because like I said, AI is changing so much. They're the ones that are going to continue to be successful no matter what kind of technology comes down the road.
Yeah. So are there any particular skills that you see as, these are going to be the most valuable skills for people in your profession to really focus on in this AI world?
Yes. So I love reminding people that, AI isn't exactly like creating a whole new profession for us. It's actually kind of, I look at it like it's amplifying what we've always known and what we've always brought to the table. So like I've said a couple times, information governance is a big one. And I think that is where we can add a ton of value to an organization. But of course, just staying current on all of the core domains that we have in our profession, like clinical documentation, integrity, coding, classifications, data quality, privacy and security, all of those things, those are all going to be important even in an AI world. But the other one that I keep stressing a lot when I talk about this is that things like critical thinking or ethical judgment or just these soft skills, being able to communicate and collaborate, having emotional intelligence, problem solving. I mean, all of these are things that, AI, at least as of today, is not able to do or replace the human. And so, AI can go out there and it can recognize patterns and all that, but it can't build trust, with your patient or with your coworker. AI can summarize information, but it just can't navigate interdepartmental politics. That is a reality in organizations. So, I mean, there's just always going to be that human judgment that is needed. And I think those professionals that have those capabilities and keep fostering those are going to be the ones that have the biggest differentiation, I think, from their counterparts.
I love that because, especially in the work that I do around the human experience.
Yes.
That this is where I see a huge opportunity for organizations. And when you were talking about critical thinking and communication and interpersonal relationships, and
yes,
we no longer call those soft skills. And in the
Okay.
AI world, I'm calling them power skills.
I love that. Okay.
Because
Power skills.
honestly, it's a key differentiator because the more we rely on technology, the more important high touch is becoming.
Yes.
And so, I don't know if the rest of the world is calling them power skills. I'm calling them power skills.
I'm going to call them power skills.
But no, it's true. And, I think too about the human experience and where the average Joe comes in contact with your world seems to be in the patient portal. They have some influence they're actually adding to it. They're taking from it. They're an observer, but it's both push and pull. And I see the more that AI gets involved with this, there are so many positives of how we can manage chronic disease, how we can, involve the patient more in their care.
Oh, yes.
Yeah,
I
any thoughts on that?
Yeah, I mean, I'm a huge believer in that, in patient literacy, health literacy with our patients that, the more that you know about what you have going on with yourself, the better able you are to address the issues. I mean, and I've publicly talked a lot about my dad and his multiple conditions that he has. And, unfortunately, my dad was a police officer. So, medical terminology is just not a thing that he understands. So
Right.
it's really difficult, number one, for him to understand how to better take care of himself or prevent things from getting worse, let alone trying to communicate and explain to me what happened in the doctor's office or the specialist's office because he doesn't know the words that they're saying. So it is a huge thing. So having a very good patient portal where you can have proxies, like adult caregivers like myself or, adults for young children, things like that's also important. The one downside of a patient portal that, we've been talking a lot about is it's another way to enter your healthcare system and potentially creating a duplicate record because of the way that we are registering patients in our systems that if you're not, like if I would join a patient portal and I would call myself Jenny Miller, but in my hospital, the record is Jennifer Mueller. It may have created, if the system wasn't smart enough to know that my name, date of birth, and other identifying factors are the same, that I'm the same person, it could create a duplicate record. So it's just something I just wanted to mention because portals are great, but it just is another entry point in that sometimes creates other problems down the line, but
Yeah.
definitely
And
not weighing the benefits for sure.
I'm just wondering if AI is going to be an integral part of being able to scan all those records and say, hey, wait a second, Jen Miller is the same as Jennifer.
Yes.
Can we merge these?
Yes. And AHIMA just released the 2026 patient naming framework, and we've been talking about it to many different organizations over the last few months, and it really sets a standard for how organizations should, when a patient presents, how they should register the patient's name by, number one, using their government issued ID, asking for that ID, and a few other standards that we set around newborn naming, where it's a very high frequency of multiple duplicate records, multicultural naming, standardization, things like that, and just some other rules around making sure that your IT system, so this is where now health information professionals collaborate with the health IT professionals in making sure that the systems are set up right to ensure that we can capture the patient name the way the standard is suggesting, by not truncating long last names. The field should be long enough to accommodate a long last name because, to your point about AI, if those fields are not accurately completed, the algorithm that's going to do the patient matching comparison, it won't work because, it's comparing apples and oranges. So sorry,
Yeah.
I got off on a whole tangent there about patient.
No, that was good. I appreciate that because it's important. I mean, and the AHIMA standards are become even more important in this world.
Mhm. Yes.
So the other thing too is that, when we're integrating AI into the informatic workflows, et cetera, the documentation, the ambient listening, the first level charting that's happening, it seems like it's building accuracy in the beginning. Are you seeing that it is the ambient listening and documentation, is it doing what it promised to do? And how is that impacting coding?
Yeah, we have done a little bit of dabbling into some of those organizations and vendors out there that are doing the ambient listening, and we haven't done a whole lot, but it definitely is doing what it's supposed to be doing in terms of capturing that encounter. And this is not coming from like a specific audit or anything we did. This is definitely more of just anecdotally what we're hearing. But some of the medical coding for, simple radiology procedures, E&M coding and the EDs, things like that, primary care, stuff like that, it's doing a really good job. I think it does still have a way to go. Like, I don't believe there's any systems out there that are coding inpatient records because inpatient's very complex. And the other thing I was going to say is there are a lot of coding guidelines. So, for example, the systems out there, might not be set to record a combo code. Instead, they're listing 3 separate codes, things like that. So that's why it's so important to have the coding validators, these new roles to be able to continually audit what's coming out of the AI tool, because, you have to constantly be training it and monitoring, what's going in, what's coming out. And it's an important human in the loop kind of role that you keep hearing about.
So when you look ahead, looking ahead, through your glass ball or your crystal ball, how do you see the role of health information continuing to evolve?
Well, I think that we are going to continue to be elevated. I really do. I often think about what we do in healthcare, and I can't picture any other professional doing what we do. I mean, we touch patient data from the time the patient comes in the front door till the time, you're in an organization, the bill drops or bill go out the door, and you might get a denial. Until that denial is resolved, you have someone that is a health information professional every single step of the way. And so, yes, there will be, and there already is, AI on the different parts of that flow. But at the end of the day, we still have to make sure that anything that is complex, somehow becomes an exception on some sort of exception report or whatever that a human can look at. So we're going to still need those basic skills that we've always had, but we will be using them in a way that's much more elevated along the way. So that's kind of how I see it evolving. And yeah, in AHIMA, we're here to just continually we're constantly looking out on the horizon as to what's happening, what's changing in the industry, and then trying to respond by creating resources for our professionals and professional development to make sure they're upskilled. I heard a new word lately. It was called pre-skilling. So it's like you're learning skills for a job that you don't even have yet. So I thought that was kind of an interesting word to look at as well. But so I think our future is bright. It's just different, and it's going to be, I think, better than it's ever been.
Yeah. And just as a wrap-up question, if there's one message that you'd like healthcare leaders to take away about the future of health information, what would that be?
Well, I would love that healthcare leaders would not think of health information as a department that manages records, because we are no longer that anymore. I think that healthcare leaders should look to the health information profession as the profession that makes trustworthy healthcare possible, because as we embrace AI and interoperability and the digital health, everything, none of that succeeds without trusted information. Technology alone isn't going to transform healthcare. I think people will. And I think the professionals who understand information, the governance aspects of it, quality, ethics, trust, all of that, all these professionals need to be at the table from the very beginning, not after the technology's already been implemented, like we said earlier. So I think the future of healthcare is definitely, absolutely going to include AI, but the future of AI depends on trusted health information. And that's where AHIMA has been leading for nearly 100 years. And I believe that our profession's greatest impact is still ahead of us.
Fabulous.
Well, that's really great. That's a great way to maybe bring the conversation full circle. I think that it's just really important to be mindful how the technology is going to continue to evolve. Organizations are going to continue to evolve, but to have that let's say, independence, viewing it from how do we think about it to anticipate what's next? And what can we do to develop standards and policies that are more prescriptive for this future state? And then even anticipating, well, what are some of the leadership challenges, the power skills? Chris, I love that thought process that, this is maybe how you can bring thoughtful design, systems integration, more of these systems coming together to avoid that duplicative effort you mentioned, Jennifer, on the difference between the portal and what's in the record and how all that can be avoided. It sounds like maybe that's a great use for the role, is to anticipate these things. Now that the systems are more integrated and they're getting used in a different way, is the opportunity to really bring in solutions that align with that. So I really appreciate that perspective. So I guess in closing, Jennifer, how can people follow you or contact you? And then I would say, Chris, maybe if you don't mind letting the audience know the same thing about you.
Yes, I am on LinkedIn. I'm very, very active on LinkedIn. So that would be a good place to find me. The other place I would say is to follow AHIMA.org, because we have lots of great things coming out from our organization standpoint, and we're leading the way with all of this. So I encourage people to stay posted on the great events and different opportunities that we have.
And as for me, you can find me on LinkedIn too, with my name as it is on the screen, and also our website, which is Baird-group.com. And there you can find out more about our customer service training, leadership development, and culture transformation work.
Well, that's perfect. So thanks everyone for listening to Beyond the Blueprint. So if you enjoyed this conversation, please subscribe and share the episode with a colleague. We just look forward to continuing this conversation where we explore the people, ideas, and innovation shaping the future of healthcare and health information. So again, thanks again, Jennifer and Chris, for joining. And until next time, thanks for listening, everyone.
Thank you so much.
Thank you so much.
Thank you for listening to Beyond the Blueprint. Together, we're exploring how thoughtful design can simplify complexity, enhance patient care, and create meaningful change. If you found value in today's episode, make sure to subscribe and leave a review in order to help us continue the conversation. Let's reimagine healthcare together on Beyond the Blueprint.